Hello and welcome to AskDrOlsen.com. My name is Dr. Greg Olsen and I'd like to welcome you today. Let me tell you this, as you're visiting here, I'm here to help you. I am a wellness expert, and as a wellness expert, we focus on three main areas as the cause of your problems. Let me ask you a question. If there was something with regard to your health or your life that you could change, what would it be? Would it be that neck pain that's been giving you headaches and pain into your arms? Would it be that low back pain that's kept you from your activities and maybe in bed? Would it be that sciatica giving you pain down your legs? And could it be that carpal tunnel syndrome with pain, numbness in your hands? Is it that hypothyroid problem allowing you to be fatigued and sluggish? Is it your digestion? Whatever the problem may be, let me tell you, I'm here to help. As a wellness practitioner, as I mentioned before, there's three main areas that we look at. Let me tell you about them. The first area has to do with poor nutrition and chemical toxicity. With poor nutrition, that simply means the food that you're eating is junk and it's causing problems with you. Chemical toxicity has to do with the fact that we're exposed to 82,000 chemicals. Between poor nutrition and the chemicals that we're exposed to, our body can become toxic and make it more inflammatory, painful. That's the first area. The second area has to do with hormone imbalances associated with chronic stress responses. Your adrenal glands are your stress response gland. The hormones that we're mainly talking about have to do with cortisol and DHEA. These are stress hormones. So when these hormones are out of balance, they can affect your body's ability to sleep, brain, your cardiovascular or heart health, your digestion, broad range of effects. So that's the second area. The third area has to do with hidden neurological damage. That mostly has to do with when you've been in an accident and a trauma, done something in the past where your spine may have been affected, causing trauma or injury to the nerves. Maybe not with pain, but that is an area that we find. It's called hidden neurological damage. That's the third area. So with regard to these areas, and as being a wellness expert, let me do this. I'd like to invite you into the office to find out if I can help you. Very simply, that's because my purpose in practice is to help as many people as possible, and hopefully that next person will be you.
Hello, my name is Willie Perry, and I've known Dr. Olsen for over 2 years. I came to him as a referral from a friend with severe neck problems. I was having degenerating discs for probably about 15 years, to the point that I couldn't hardly use my arm. I had numbness, and I had trouble with the upper back and that type of thing. And so I came to Dr. Olsen, and the first visit I had enough relief that I could go back to my job and function and do the things I needed. And I've stayed with him for 2 years and am doing quite well. As well as that problem, I've had hormone issues that he's helped to stabilize. I've had cholesterol issues that we've been able to take care of without prescribed medicines, and I'm feeling better than I have for years. I'm sleeping probably 1 or 2 hours less a night. Digestive problems have gotten better, and we travel out of the country quite a bit, and I've had some parasite problems, and those have always been taken care of. And I've had weight issues and have lost 25 pounds and been able to keep it off with Dr. Olsen. I just am a real fan of Dr. Olsen's, and I would recommend you come see him and see what he can do for the conditions you may have. He's very kind and considerate, and will go as far as he can go to help you. Thank you very much.
Hello, my name is Dr. Greg Olsen. I'm here today to talk to you about headaches, where they come from, what to do about them. I've been in practice for over 17 years, and in that time, I've helped thousands of patients with headaches and other common problems. With regard to headaches, there are some common things that we see that are a problem with that. I'll tell you quite up front, with headaches, we don't find it being a deficiency of aspirin, ibuprofen, Tylenol. Those aren't problems that cause headaches. The most common source of headaches coming from the neck, up over the head, and over to these areas come from these structures in the neck, including the vertebrae, the joints, and the muscles. Now, when we look at the spine, we've got a whole lot of area here eligible to cause problems that can refer up to this area of the lower neck, base of the skull, and the head. We have what's called the zygapophyseal joints, that if there's trauma to the spine or in these areas, they can refer what's called sclerogenous pain. They can go up to these areas. Also, we're going down into the neck and shoulders. These muscles up in here are suboccipital muscles. These are very classic as far as being what's called source of what's called myofascial pain and dysfunction, sending pain up to the skull, sometimes causing a headband type of headache. These are some of the muscles that attach from the side areas here, semispinalis muscles, that again have referral pain patterns that can go up to the head. Now let me show you what those can look like. Now many times when we're looking at headaches, we think it's just from the head, but what we've got here is these long muscles that attach them through in these areas can have what's called trigger points for myofascial pain and dysfunction. This trigger point or area here can be associated with pain through the neck in this area, and this is one of those suboccipital muscles causing a headband type pain. Okay. Also this one here, another suboccipital muscle causing pain up the back side of the head. So what's responsible for that? Sometimes it can be stress or tension. It can also be traumas. That trauma can be an accident, it can be a fall, it can be a repetitive action or position at the computer, repetitive action at a desk. We can also see in that area problems related to nutrition or chemical toxicity. So really the key thing with headaches is finding out where they're coming from. That can be a physical source, trauma, irritation. It can be a chemical source, poor nutrition, chemical toxicity, or it can be from stress causing tension and pain into the areas. So those are three keys with regard to headaches. Hope that's helpful. If you need further assistance or would like to find out if this treatment can be effective for you, then please give my office a call at 949-859-5192 or visit us at AskDrOlsen.com. We'd be happy to help you. My purpose in practice is to help as many people as possible, and hopefully you'll be next.
Hi, my name is Ken Konecki. I have a background in sports and entertainment marketing. I also work with training athletes, NBA, college, elite high school, and grade school athletes. So to me, to be able to perform is very important. I came in here off a referral, and Dr. Olsen started taking more of a holistic approach. I came in here in very bad shape based on the foods I was eating and not really getting the proper care from a chiropractic standpoint that I needed. So when he diagnosed me with just, doing some things that were a little bit outside of my sphere of understanding, I had to just have some trust and really bank on that he knew what he was doing. So I encourage you to just follow along the plan. He's helped me tremendously. I was in very, very bad shape coming in here, and within 4 months I felt results. Within 6 to 7 months I felt I was back up to par, really doing everything I wanted to do and moving forward and alleviating those things in the future based on my understanding of what he was doing over that time frame. So you ask why come in here and allow him to treat you. It's because he knows what he's doing. He's got a gift in that area, and I highly encourage it. And I'm now back, helping people through sports, entertainment, and just very grateful.
Hello, my name is Dr. Greg Olsen. I'm here today to talk to you about fibromyalgia. Fibromyalgia is a chronic condition, and if you're listening to this today, you may be suffering from it or thinking that you're suffering from it. Fibromyalgia as a diagnosis, as a clinical diagnosis, comes from having chronic muscle pain of over 3 months duration. Has to be both left and right sides of your body and both upper and lower parts of your body. It is categorized with 18 tender points, of which you need 11 in order to classically qualify for the diagnosis, in addition to chronic fatigue. I've been treating fibromyalgia for over 17 years. One of the difficulties with this is there's not a single factor or entity associated with it. And that's why we see people who attempt to solve this through drug therapy, mostly they end up taking serotonin and manipulating drugs, antidepressants, is that it doesn't address the full complex of what's going on. Now today I'm going to share with you 3 of the success secrets that we've had with fibromyalgia. Now that begins with looking at number 1 is brain function. With brain function, that's the most important thing that I have seen with regard to fibromyalgia. with brain function, the key thing I'm looking at here is how the message is going up through the spine, come up through the brainstem to the cerebellum, cross over to the frontal lobe, and then feed back to an area in the lower brainstem called the mesencephalon. Now that's a fancy word, but the mesencephalon is the control center for the messages going back down to the body for things such as the C pain fibers. So when this is overfiring, those pain fibers in your body are overactive. So it's very key to be able to know if that process is being regulated or not. The other part with regard to brain function is we look at how is the brain getting its activation or fuel. Okay, those are two key things, activation and fuel. 90% of the messages to the brain come from your body and have to process through this cycle here. So if there's an abnormality, an aberration, a problem, a trauma in those areas, that's going to be one area that causes this problem. The other area has to do with the fuel supply for the brain. Number one being oxygen. Oxygen can be affected by poor nutrition, chemical toxicity, different types of anemia. The other fuel for the brain is blood sugar. So when we talk about blood sugar, that's going to lead into the next area that I talk about for brain function, blood sugar and laboratory values. So when we talk about blood sugar, the laboratory values for blood sugar can range anywhere from 70 to 110. When you're in that range and doctor tells you everything's normal, where do you go from there? You're still having problems. So what we look at is an optimal or functional range. That functional range can be 85 to 100. So if you're within that range, we know things are pretty good. If you're below it, there's a good chance you have hypoglycemia or not enough blood sugar in order to feed the brain and the rest of your body. If it's over that, we could be looking at problems such as insulin resistance or dysinsulinism, telling us that your body is, again, not regulating blood sugar properly, again, neurologically affecting how this mechanism is going to regulate. Now, I mentioned laboratory values. The laboratory values, not just blood sugar, but overall, is a key area that we look at. Again, laboratory values from the lab come back very, very broad, very big range. And again, if you're in that range and you're still having problems, it doesn't help us figure out what's going on. So we look at that optimal or functional range. Again, I mentioned for blood sugar before, and one other example, especially with regard to the thyroid we look at, is how, with the blood sugar, is how the thyroid is doing. So with the thyroid, the laboratory range can be 0.5 to 5, saying you're normal. But from an optimal standpoint, we look at it to be from 1.8 to 3. And then we also look at how the T4 and T3 numbers are in relation to that to tell us if there's one of 6 conditions happening with the thyroid. All right? So the 3 secrets I shared with you today with regard to fibromyalgia, that are the top 3, have to do with brain function, have to do with blood sugar regulation, and have to do with looking at your lab values. Not the broad range, but looking at an optimal or functional range. Thank you for listening today. If you need more information, if you'd like to find out if this type of approach or treatment is helpful for you, then please contact us at 949-859-5192 or visit AskDrOlsen.com. My main purpose is to help people get better, and I'd like to see you be the next person.
Welcome. We're here today with Dr. Olsen,
Hi, Denise.
our expert on headaches. And we are going to talk about headaches, a very common problem that people have. And Dr. Olsen is going to talk to us about that.
Thanks, Denise. It's great to be here today. Today we're going to talk about headaches, and one of the things about headaches is today, for example, is about headaches and stress. So, Denise, you've probably maybe either yourself or known people who have gotten stressed, and during the course of that process of being stressed, get a headache or develop a series of headaches or suffer headaches on a frequent basis because of stress.
Yes.
So, many people want to know, how does stress cause headaches, and what do you do about it? So Denise, one of the things that happens is when people have chronic stress, it actually affects, as you may have experienced or know people who have, tightens up the muscles. Okay?
Right.
And very simply in the spine, in this area here, there's muscles and ligaments and tendons, and when there's tightening like that, it basically creates what's called trigger points. We call it myofascial pain and dysfunction, and those trigger points can refer pain right up into this head and neck area. Okay?
Thus causing a headache.
And thus causing headaches. And so stress also affects our blood supply. So
important blood supply.
yes, well, it's all over the body, but commonly that headache is the area where it's felt at. But what happens is with stress, the blood vessels constrict. It affects the blood vessels in the muscles. It also affects the blood vessels to the head area. Sometimes people get it to the extent where they may have migraine type headaches, but stress type headaches very commonly have that component as well, where they don't go to that extent.
So if someone's experiencing a headache, what would be something that you would do if they came in and said, I have a chronic headache? What would be something that you, as the expert of headaches, what would you do?
You know, what I've found to be the most important part of it is finding out the cause. It's what we call finding the root cause of a problem. Many times people will treat it with a Band-Aid, and that's either
an aspirin
or an ibuprofen. Do things to treat the pain.
Mm-hmm.
And obviously you need to be comfortable, so you need to be able to get rid of the pain. But more importantly, if it's occurring on a regular basis, is to find out that root cause. Why is it happening?
So instead of continue to mask the pain, you want to get to what is causing the pain.
Correct. And in the process of helping people to get better, there's what I describe as two parts to it. One is typically if you've had stress in that capacity, usually there's a certain amount of damage that's happened to the body. So we need to find that damage, we need to fix that, and that's part of where I come in.
Mm-hmm.
The other part is getting rid of that stress or finding out ways of managing it better. And sometimes that could be a person in your life, it could be a situation in your life. Sometimes it's a physical stress, a job or a position or a repetitive activity that is that stress.
Traffic on the freeway.
Can be traffic on the freeway, exactly. So most important is for my part is to talk sometimes in extensive detail with the person about what's happening in their life, where are those details at. It might be how they're sleeping, it might be that position they're working at, it might be the stress at work, it could be stress at home. Identifying those and seeing again what the damage is, and then what needs to be done as far as life-wise to get rid of those, or modify them, or change the way that you respond to them.
So let's say someone is interested. How would they go about coming to see you?
Well, the best way to get started is to call the office, and they can get scheduled for a consultation. The number at the office is 949-859-5192. We have a lot of great information on our website as well. That's AskDrOlsen.com, where you can find out more about our treatment approach and more about headaches and these causes and what we do about them.
Excellent. And so you've had a lot of good results with people feeling relief from their headaches.
Oh, absolutely. And not just relief, because sometimes relief is easy to come by, but actually relief and finding that cause.
So long term.
So long-term results. That's what my plan is for patients is if they've been having headaches for a period of time, is to identify these things we've talked about, so that they just don't get rid of the headache for today. They can know that their headaches are going to be gone and know how to better manage things to keep them away.
Great. If someone wants to know more about you, they can go to AskDrOlsen.com.
Yep.
And then again, your phone number is 949-859-5192.
All right, great. Thanks for being with us today, and we'll catch you on the next video. Thank you. Bye-bye.
So today we have a wonderful topic on hormones. We have Dr. Greg Olsen, who is right here. He's a chiropractor who is very much into natural healing, something we all love. He's not about masking the problem. He's really about getting down to the underlying issue. And he is in the area. He's in Lake Forest. So he's going to have an amazing topic today, and you're going to be learning tons.
Thank you, Tina. Good morning, Saddleback women.
Good morning.
It's great to see you this morning. And my name is Dr. Greg Olsen. Tina already introduced me. I am a local doctor. I've been in practice for 17 years. And today, my hope is to share with you what my experience has been in 17 years as far as working with women on a natural basis, I will say a precursor basis to balancing hormones. So as we work through this, let me ask you today, how many of you were sent here today by some significant other saying that you need to get your hormones balanced? Raise your hand. So that happens sometimes, but in the course of today, we're going to go over some of the problems that happen with hormones. We're going to talk about different ways to address them or assess them, and then There'll be a little demonstration at the end, and move on from there. So there may be questions that come up for you during the time of the workshop. I'm going to ask you to hold those until the end. I'm going to try to get through this material so I can make sure that you get the information. Okay? When I do these workshops, I always like to introduce that as a doctor, many people think that as a doctor, the job is just to treat people. But if you look up the definition of doctor, doctor means teacher. So as my first role that
Hi, I'm Erica. I'm 47 years old. I originally came to see Dr. Olsen at the recommendation of my fiance, who was seeing him for some back issues and some other things. I was having trouble with hormones, perimenopause, hormones out of balance, just feeling out of control with that. And I was thinking of seeing a doctor that specifically dealt with that. And my fiance mentioned that Dr. Olsen covered all this stuff too, so I came in and had a consultation, and he let me know that he would be available to, pretty much go over all of that and hopefully try to figure out what was going on with me. We did a whole lot of tests and got things under control pretty quickly. And I have to say that it's only been a few months that I've been coming, but I've noticed a big change and I feel a lot better. And what I love about Dr. Olsen is that he treats the whole person. I did have some issues with my neck, and we're working on that, but just all the other things that were going on and, have just been helped so much. And I can't, recommend highly enough. If you are going through that, and I know a lot of women are, and it drives you crazy and makes you feel horrible, if you want to find out what's going on and do something about it and feel like you're past that point where you just are going nuts, you can come on in and see him, and he'll figure out a course of treatment that will work for you, and you'll be pretty happy in a pretty short amount of time.
Contracting the sounds of the heart is significant because the sounds of the heart are produced by the opening and closing of the valves. And so what does that? The contraction of the different chambers in the heart. So basically, this tells us very significantly about the strength and efficiency of how the heart is working. Okay, what influences that? So nutrition, essential fatty acids, adrenal function, liver function, many of the things that we've talked about in different capacities. But one of the things that is also very interesting about it, and this is a bit of a chiropractic twist, is to see the structural connection. Many times we look at charts like this and see that there's a connection of nerves that go out to the different organs. To determine that connection, or if it's being affected by it, is sometimes difficult. So there's a little check that we'll do on Craig tonight to see if we can find that being present. Did you want to say thank you to your wife?
Love you, hon.
Hello and welcome to AskDrOlsen.com. My name is Dr. Greg Olsen, and today I'm here to show you how to apply ice. Ice is best applied in situations if you may have some significant pain, either the low back, mid-back, neck, it could be the shoulders, the knee. Today I'm going to show you on the spine, on the back. When you apply ice, first thing you want to do is have an ice pack. If you have a cloth-covered ice pack, you can apply this directly to the skin. You would bring up the shirt, apply it directly over, and let that ice apply to the area for 10 to 20 minutes, and then reapply once every hour. If you have made your own ice pack, and it's not cloth-covered and it's ice cubes, then what you need to do is put a protective layer. It could be as simple as a paper towel, bare skin, paper towel over, apply the ice pack, 10 to 20 minutes, and repeat once every hour. If that is too cold to start with, then you can take a towel, thin towel. If it's not thin enough, then it really won't get the area cold enough to do much good for you. So again, bare skin, ice pack over, 10 to 20 minutes, reapply once every hour. So you can also apply it if you have a thin shirt, you can apply it directly over that. Again, try to get as close to the skin as possible, as thin a layer as possible, without risking causing any burning to the skin from the ice. If you have a problem that's not responding to the ice, it's not getting better after a day or so, then please give us a call. That's something that may need more attention, and we'd be happy to help you. Thank you, and have a great day.
today with Dr. Olsen. Welcome, Dr. Olsen.
Thanks. It's good to be here today, Denise.
And our subject today, we had spoke before about headaches, but today we're going to talk specifically about headaches and the spine. And there's a whole industry that is devoted to headaches, and yet we have our expert here, Dr. Olsen, to talk about alternative ways of dealing with headaches, and specifically today, headaches of the spine.
Excellent. Yes, thank you, Denise. Today we are going to talk about headaches and how they can come from the spine. Many times we look at people experience headaches and may think that it's entirely coming from around the head, not realizing that many times this area in the neck is the area where it's coming from. So there can be different causes with that. In the neck we have a group of muscles, we have ligaments, we've got tendons, we've got the spinal joints. Each one of those tissues and areas can be associated with a source of pain that can cause headaches and refer pain up to the head and neck area. Okay, so I brought a little model here, and this is a way of showing some of how it works. With the spine, these are the spinal joints in this area. When we have a problem with alignment in the spine, or the spine's not moving properly, we can get irritation to the spine. And so in this area here, this clear area would be an area where it's working normally. Okay, this area would be an area that's inflamed, that's red. Okay, and this area would be an area where it's been inflamed for a period of time, and scar tissue has begun to form. Okay, but what happens is when you have the spine and it's not moving correctly, okay, the muscles that are attaching into the spine can then become irritated. These joints are giving feedback to those muscles, and so when they're moving improperly, they give improper feedback to the muscles. The muscles then start to tighten and spasm. That leads to a situation called myofascial pain and dysfunction. It's basically where the muscles get knots and small knots in them. Those knots produce pain, and those one characteristic of them is they refer pain. And in the neck, they commonly refer pain. Yes, it can be the base of the skull, top of the skull, front of the skull here. So the great majority of the time when people or patients come in and they're experiencing headaches, obviously we look for head areas if there's problems with that. But I'd say a big majority of the time we are looking at problems related to the structure of the neck, muscles, ligaments, tendons, or those joints in the spine.
Fascinating. So it sounds much more complicated than just taking an aspirin. So let's say someone was interested in finding out more about headaches and how they initiate from the spine. How would they go about coming to see you, Dr. Olsen?
Well, the best thing that you can do is contact the office. We can get you scheduled for a consultation. The phone number at the office is 949-859-5192. The second option is you can visit our website, AskDrOlsen.com. That's a great place for information. You can see more about these details, how we approach headaches and chronic problems, and without any drugs or surgery.
Well, it sounds great if someone wants something alternative. And there's, I'm sure, information on you and your practice and how long you've been practicing as well on the website?
Oh, definitely. It's got a great deal of information in there. Get information about myself, about the practice, about how we approach these types of problems. And some great success stories on there, so you can see what other people have experienced in their treatment with the office.
Great. Thank you so much, Dr. Olsen, and hopefully you've learned a little something. And for more information, again, you can go to AskDrOlsen.com. Have a great day.
Hi, my name is Dr. Greg Olsen, and today we're here to talk about peripheral neuropathy and how to stop the pain of peripheral neuropathy. I've been in practice for 17 years, and I've done over 900 hours of postgraduate training, board certified in chiropractic kinesiology. Currently, I work with a group of about 1,000 doctors across the country who focus on neurologic and metabolic problems such as peripheral neuropathy. Today, I'll be sharing with you some of these problems and their solutions that we've found. So, first off, you may want to know what is peripheral neuropathy. Peripheral neuropathy is a problem with the nerves that carry information to the brain and the spinal nerves. This can produce pain, a loss of sensation, inability to control muscles. The true definition, when we break it down, peripheral means further out from the body, distant from the brain and spinal cord, so we're not talking about spinal cord injuries or issues or brain issues. Neuro means the nerves, and pathy means abnormal, so abnormal nerves in the peripheral or outer parts of the body. So The 7 signs of peripheral neuropathy, or how to know if you have peripheral neuropathy, are listed right up here. We look at numbness, burning feet, cramping, sharp or electric pain, pain with walking, difficulty sleeping because of leg discomfort, or prickling or tingling in your extremities. The symptom really depends upon which type of nerve is affected. There's 3 different types of nerve tissue. One is sensory, the other is motor, and the third one is autonomic, and that carries information to the organs and glands. So when we talk about the first category is the sensory fibers. And damage to the sensory fibers can result in changes in sensations such as burning sensations, nerve pain, tingling or numbness, an inability to determine joint position, which can cause incoordination. For many of these neuropathies, the sensation changes often begin in the feet and progress towards the center of the body. Diabetes is a common cause of this type of neuropathy, or sensory neuropathy, and that's usually mostly it begins in the feet. The second type of nerve involvement begins with the motor nerves. Damage to the motor fibers can interfere with muscle control, can cause weakness, loss of muscle bulk, loss of dexterity, meaning incoordination, sometimes tripping or bumping into walls. Sometimes cramps are a sign of motor nerve involvement. And other muscle-related symptoms can include, depending upon the area, difficulty breathing or swallowing, difficulty or inability to move a part of the body, falling, can be from legs buckling or tripping over things, a lack of dexterity, being unable to button a shirt or do the finer motor movements, a lack of muscle control, muscle atrophy, muscles can twitch or begin cramping. Now the third category had to do with autonomic nerves, and these nerves control the involuntary or semi-voluntary functions such as control of the internal organs, blood pressure. Damage to these autonomic nerves can cause abdominal bloating, can cause blurred vision, constipation, decreased ability to sweat. That would be like on a hot day when other people are sweating, skin just doesn't sweat. Diarrhea, difficulty initiating urination, feeling full after eating a small amount, incomplete bladder emptying, heat intolerance with exertion, can be impotence in males, nausea or vomiting after meals. Also can include unintentional weight loss, we say more than 5% of the body, and also can be urinary incontinence. So the different nerve fibers that can be involved, the 3 different ones, sensory, motor, and autonomic. But what causes neuropathy? The causes of neuropathy can have varied issues. It can be arthritis, spinal stenosis, bulging discs in the spine affecting the nerves as they come out from the spine, statin drugs, which are oftentimes used for cholesterol and hypertension, diabetes, type 1 or type 2, can be from poor diet, leading to different types of nutritional deficiencies that would be associated with neuropathies. Genetics can also be involved. Most of the time with these, we look at 80% of the involvement is typically lifestyle, 20% may be genetic predisposition. Statin drugs inhibit the formation of cholesterol. It's used to synthesize cholesterol is used to synthesize coenzyme Q10. That's necessary to generate ATP, adenosine triphosphate, which is necessary to produce energy for any cell in the body. So that ATP production decreases about 1 year, 1% per year. So as we age, that number increases, which increases the likelihood of there being cellular energy issues, which can lead to this peripheral neuropathy factors. Taking statin medications can suppress that ATP production to the point at which the neurons or the nerve cells cannot maintain their ability to send nerve signals. This is what's called the frequency of firing, or how the nerves transmit their messages, which will cause them to decrease. Okay, so this is perceived by the brain as numbness and tingling, depending upon the exact fiber which is involved. Okay, So statin drug use basically increases peripheral neuropathy risk by 16 times. So another common cause is diabetes. Diabetes has to do with insulin. It's a hormone produced by the pancreas to control blood sugar. Diabetes can be caused by too little insulin, resistance to insulin, or both. And diabetes commonly leads to neuropathy. Basically, what we're looking at is all chronic health conditions seem to have a common thread. Oxygen deficiency, neurological issues or misfiring, metabolic imbalances, blood sugar control, cortisol imbalances, hormone imbalances, anemia, autoimmune attacks, and brain imbalances. So when we look at the brain has key areas that are involved with controlling the body. So in that messaging from the brain to the body, we look at things such as neurotransmitters. The brain can't communicate with the gland unless there's a neurological connection and a chemical connection, that chemical connection being neurotransmitters such as dopamine, GABA, serotonin, acetylcholine. So when there is a problem with this feedback loop to the brain, we can get what's called overfiring of the midbrain. So basically we've got fibers going up to the brain sending the messages. Messages to the brain come back down to the midbrain to an area called the mesencephalon. Mesencephalon, if it's overfiring, can contribute to insomnia, light sensitivity, migraines, urinary tract infections, chronic pain, peripheral neuropathy. So part of this process is looking at your lab ranges. When we look at laboratory ranges, we look to see where they fit. Are they in the normal range? Lab ranges are traditionally very broad in their range. And so what we do is we look at what's called functional lab values, which is a narrower range that allows us to see where problems may be developing. So some lab ranges, you're not going to be out unless you're really high or really low in that functional range. It's a tighter range. And for example, blood sugar in the laboratory range traditionally ranges 65 to 110. From a functional standpoint, we look for 85 to 100. Outside of those ranges, we begin to look at what is not working properly. So the critical areas in the metabolic assessment of peripheral neuropathy would be looking at anemia, which affects oxygen carrying capacity to the nerve and its tissues. Blood sugar, which is the fuel supply for the nervous system in the brain. We also look at the gastrointestinal tract and the liver, fatty acid metabolism. All factors with nerve health, neurological health. So as part of a complete and comprehensive peripheral neuropathy workup, we do a series of neurological tests and a series of metabolic tests in order to determine what is the most appropriate course of treatment based upon what the problem is. So a thorough and comprehensive physical exam ensures an accurate diagnosis. These neurological tests can include blood pressure, pulse rate, looking at pulse oxygen, your heart rate and rhythm, saliva pH, reflexes, your eye tests, cranial nerve, tests for balance and coordination. And beyond that, next what we look at is when there's an issue with regard to the brain, we look at the two things that are necessary for that neurological function, fuel and activation. So the fuel is oxygen and blood sugar. Activation has to do with a little bit of what we talked before about these pathways that come up from the brain. So there are different pathways and there can be problems with those, and different therapies we may use for brain activation, neurological activation. Could be vibration therapy on one side of the body, gentle manipulation on one side of the body. It could be TENS units, heat, ultrasound, traction, oxygen therapy, mirror therapy. So those are some of the key components of that. Additionally, we can use upper body ergometer for that stimulation. Auditory stimulation in one ear, that can be music, a metronome. We can also use what's called auricular stimulation. Auricular stimulation happens when we stimulate areas around the ear, has a very strong correlation or feedback loop to the cerebellum. We also can use what's called a warm caloric in one ear. The fibers in the ear stimulated by warmth, again, strong connection to the cerebellum. Olfactory stimulation, stimulation one side of the nose, sometimes also different types of visual stimulation and imagery, checkerboard patterns, colors, faces, eye exercises. Other therapy for brain activation, infrared therapy, laser therapy, especially good for chronic nerve damage. We also use things such as a chi exerciser, stimulates the circulation in the body. At times, if there are spinal-related issues, bulging or herniated discs, and similar type problems, we will use a spinal decompression, non-surgical spinal decompression. When we look at the metabolic components, we then move into looking at things such as the cortisol and its hormone, the cortisol hormone balance. We do that through a test called the Adrenal Stress Index. It tells us how the cortisol levels are. But ultimately what happens is all cases are a combination of looking at what's happening neurologically and what's happening metabolically. Neurologically, treatment may end up being 60%, metabolic may be 40%. Most importantly is finding the pieces of the puzzle that need to have correction. Is it the cerebellum? Is it the cortisol? Is there anemia and oxygen deficits? Is there a feedback loop to the midbrain that's causing a problem? Is there hormone imbalance? Is there a blood sugar problem? Is there a structural physical pressure on the nerves that's contributing to this? So correcting these problems in the neurological and metabolic puts the pieces of the puzzle together and allows us to get on the right track and fix the problem and get the peripheral neuropathy doing better. Anyways, I want to thank you for joining me today. This was a nice presentation with regard to what is peripheral neuropathy, neurological and metabolic components related to it. And if you have further questions, you can certainly feel free to contact me. Ultimately, my purpose is to help as many people as possible. And if you're watching this because you need help, I'd like to offer that to you. You can contact our office at 949-859-5192, or you can visit us at AskDrOlsen.com. Thank you, and I appreciate your time.